Today we'll look at how many steps per day you need to attain certain health benefits. What you might have heard of in the past is of the activity goal of 10,000 steps per day. While this is probably a good goal to shoot for, it's not necessarily based on scientific evidence, and is there really anything special about this number? So a little bit of history behind the 10,000 steps. The 10,000 steps per day goal was actually based on a Japanese marketing campaign for a pedometer, which gained popularity in the 1964 Olympics. The pedometer, which measures step counts, was the first wearable step counter. I'm going to butcher how I say it, but it was called Manpo Kai. Definitely didn't say that right, but it translates over to 10,000 step meters. So, at least initially, this 10,000 step goal was not based on science, it was based on a marketing campaign. Doesn't necessarily mean it's bad, but that's where it came from. In this talk, we'll explore how many steps per day you should aim to achieve as it relates to different health outcomes. I'm going to break this up into focusing on, we'll look at mortality, so just overall mortality, chronic diseases, and then what I think is probably the most relevant is metabolic issues like diabetes, metabolic syndrome, and then also weight gain. There's going to be two different ways to describe the relationship between steps and health. The first way is a linear relationship. For example, as steps go up, does weight loss also always go up? Or as steps go up, does cholesterol levels continuously improve? Or are there thresholds? So one is linear. Every time we take an additional step, health benefits also accrue linearly. But there's also an idea of thresholds where it's more of an L shape. So where you might go up, but then no additional steps necessarily have any additional benefits on certain health outcomes. For example, is diabetes risk reduced up to a certain point? And then if we accumulate any more additional steps, does that no longer have an impact on our overall risk? So those are two ways to basically examine that relationship. Next, why is step count good, or why is it a nice metric? So the number of steps acquired per day is a really simple measure of physical activity, and monitoring daily steps is it's more feasible for the general population. As fitness trackers and mobile devices have become more popular, so a lot of people I speak with about fitness goals do have Apple Watches. A lot of them, most of them, have iPhones. I recently saw a stat that at the end of 2020, approximately 35% of iPhone users in the United States were also wearing an Apple Watch. And there's more than 1.2 billion iPhone users in the entire world as of 2022. Another stat that I found was that the Apple Watch usage does exceed 100 million users, and this was in 2021. So I'm not exactly sure of the number, but a lot of the people that I speak with end up having wearables. I think if you're trying to increase your levels of physical activity, you might have one of those, whether that's an Apple Watch, a Fitbit, a Whoop, or any of the other trackers. Your phone also has a built-in pedometer in the health app, so you can actually look at how many steps you're taking. The next is that regardless of dose, the health benefits of walking for exercise are pretty vast. And I do encourage people to engage in less sedentary activity. And while being sedentary is another topic, it's closely related to light physical activity, like just general moving. So walking breaks up sedentary time and does have many health benefits, which we'll cover, but those include reductions in risk for all-cause mortality, cardiovascular disease, diabetes, insulin resistance, metabolic syndrome, and higher qualities of life. Before we actually get into the research, there's one more important thing to consider is that there's different types of study which need to be covered to interpret results. And these types of studies are going to be cross-sectional, longitudinal, and then randomized control trials. So cross-sectional studies just describe relationships. For example, we might see that people with cancer walk less, but we can't tell if walking less caused the cancer or if having cancer caused the person to walk less. Longitudinal studies follow people over longer periods of time. So we can look and see what comes first, the disease or the behavior. For example, we might look at 100 people without diabetes and follow them over 10 years. We might be able to use walking data to predict who gets diabetes. In randomized control trials, we could actually see specifically if increasing step count leads to better health outcomes. So, for example, we might say people that increase their daily step count by 2,000 steps have improvements in insulin sensitivity. So let's move into the research. I think a nice important question to ask first is, what is a low step count? Catherine Tudor Locke, I've seen in a lot of different research universities. I think she was out at UMass Amherst, but I also saw her in Canada, so I'm not sure where she's at right now, but she's done a lot of research examining step counts. In her 2012 paper, which was titled "The Step-Defined Sedentary Lifestyle Index," she described achieving under 5,000 steps as being sedentary, 5,000 to 7,499 steps as being low active, having a low active lifestyle, and also likely not meeting the physical activity guidelines. Physical activity guidelines are 150 minutes of moderate to vigorous physical activity per week. And she also lumped in over 7,500 steps as being active and likely meeting the guidelines. The average number of steps per day in the United States population is somewhere between 4,000 and 5,000 steps, making us on average sedentary if we are going with the definition of under 5,000 steps as being sedentary. Let's start out with the steps per day and also overall mortality. The first paper we'll look at is by Dr. Amanda Pollock, titled "Daily Steps and All-Cause Mortality," the meta-analysis of 15 international cohorts. In this study, their primary objective was to assess the dose-response association between steps per day and all-cause mortality, and also to determine if this association varied by an individual's age and also their sex. 15 studies were included for the meta-analysis, and just as a note, a meta-analysis is a statistical examination and review of the current literature, and it's really the highest form of evidence. So there is an evidence hierarchy, and I think this is good to know if you're taking someone's opinion. So I guess the lowest level of opinion is actually expert advice. Higher levels of opinion are actually research. Specifically, one of the higher forms of just sheer research is a randomized control trial. A meta-analysis takes a synthesis and a statistical analysis of all the literature in one subject. So because of all the studies lumped together with many different participants from many different backgrounds, it's the highest form of evidence that we can have. So if you're ever wondering about a question, you could always just Google Scholar and look for something like a systematic review or a meta-analysis, and not necessarily saying that you need to read the entire paper, but maybe scrolling the abstract could be beneficial if you're looking for some information. But anyways, in this study, the total sample included was slightly over 47,000 participants. They had an age of about 65 years, and 68% of them were female. Their overall median, so the most common step count, was 6,495 steps. Throughout this period where participants were followed, there was just over 3,000 reported deaths. Now, compared with the lowest quartile of steps per day, so breaking people into 4 different categories: lowest steps, 2 in the middle, and then the highest steps, then higher quartiles of steps per day were associated with reduced risk of mortality in the overall sample. There was a nonlinear dose response association between steps per day and all-cause mortality. The lowest risk for mortality was observed at 7,000 to 9,000 steps per day in the entire sample. Now, remember, they broke this up by age as well. So the number of daily steps, which the risk for mortality plateaued in adults aged 60 and older, was approximately 6,000 to 8,000 steps per day. And among younger adults, so those that were 60 years and younger, this was approximately 8,000 to 10,000 steps per day. A next 2020 review by Catherine Hall, who's from Duke, found that each increase in 1,000 steps per day at baseline was associated with a reduced risk of all-cause mortality, and this reduced risk ranged from 6 to 36%, which lends support to increasing step count, especially if your overall step count is low. In another review, Doctors Benjamin Washburn and Joseph Im concluded that daily step count is associated with decreased risk of mortality, even if this activity is primarily of light intensity or does not necessarily meet the physical activity guidelines. Additionally, the benefits of step counts all-cause mortality is probably below the 10,000 steps per day threshold. So overall, this research says increasing your physical activity is good. You might not need to achieve 10,000 steps per day to reduce your risk of any kind of all-cause mortality. That number seems to be around the 6,000 to 8,000 range. So a step away from mortality, I think that this one was interesting. It was a 2022 paper on dementia. So the title of the paper was "Association of Daily Step Count and Intensity with Incident Diabetes in 78,430 Adults Living in the UK." This is important because about 3% of adults from 70 to 74 do have dementia. As we get older, the odds of having dementia increases. So adults age 85 to 89, it's about 22% of them have dementia. And adults age 90 and older, about 33% of them have dementia. So back to this paper, it was Borja del Pozo Cruz. He's from the Center of Active and Healthy Aging from the University of Southern Denmark. And what they did was they studied dose response associations of daily steps and stepping intensity. So that's just the cadence or steps per minute. With dementia, they wanted to see if there was a relationship that existed. The researchers instructed participants to wear an accelerometer that measures, the accelerometers measure physical activity. And this was worn on their dominant wrist 24 hours a day, 7 days a week. And they were followed from 2013 to 2021. The average age of these participants was a little bit older than 61. About 45% were male, and there were a little bit over 35,000 participants. The average follow-up time was almost 7 years, so that's that makes sense. 2013 to 2021, it was 6.9 years follow-up, and in that follow-up time period, 866 of these participants developed dementia. And they found a nonlinear association for daily steps where the optimal dose of steps was almost 10,000 steps. It was 9,826 steps. And the minimal dose to prevent dementia was 3,826 steps. In this case, the optimal dose reflected an exposure value at which the maximum significant risk reduction was observed. So the maximum significant risk reduction was observed at about 10,000 steps. In a minimal dose is an exposure value at which risk reduction was 50% of the observed maximum. So there was slight risk reduction, but it was not at our maximum. So that does lend support to the 10,000 steps per day if you're trying to prevent outcomes such as dementia. Next, we'll take a look at chronic conditions. This one is going to be from Vanderbilt University Medical Center. So researchers there conducted a study titled Associations of Step Counts over Time with the Risk of Chronic Disease in the All of Us research study. And I believe this was published in Nature, which is a really high impact journal. In this study, over 6,000, so slightly over 6,000 participants linked their own Fitbit device, and they had valid Fitbit data for at least 6 months of total monitoring. So they were observed for a 6-month time period. And then in this case, participants in the study had a median age of a little bit over 56. And their median daily step count was 7,731. So that's actually a little bit higher than the other step counts that we've observed. And the steps per day over Fitbit monitoring duration of 4 years. In their study, step count was associated with reduced risk for sleep apnea, obesity, type 2 diabetes, hypertension, and also major depressive disorder. And there was a lower risk of each diagnosis at higher step count. So, for example, in comparison with the median step count, which was again about 7,000, the risk of obesity declined by 31% when steps were increased to 10,000 steps per day. Diabetes and hypertension had non-linear relationships with step count, demonstrating what's called inflection points at approximately 9,000 and then also 8,000 steps respectively. So 9,000 for diabetes, 8,000 for hypertension, where basically your risk plateaued at higher step counts. So achieving more step counts didn't necessarily reduce your risk. And participants with step count in the 75th percentile, so that upper quartile, had 24 to 52% lower risk of developing diabetes, hypertension, depression, obesity, and sleep apnea compared with those who were in the lowest quartile, so the 25th percentile. Let's talk more about metabolic health. We'll talk about weight loss and then also diabetes. The National Weight Control Registry is a registry of successful weight loss maintainers. It's actually by Raina Wing, who's out at Brown University. I'm not sure if she's still there, but it was established in 1993 to investigate characteristics and behaviors of people who had successfully lost weight and then also kept it off. Now, on average, subjects in this registry reported expending about 2,800 calories per week in physical activity, and this is roughly the equivalent of 28 miles of walking per week. And that's not necessarily saying that's what they did, but this is the amount of, miles you would have to take in to burn that amount of calories. So walking or just overall general caloric expenditure is going to be important for having a favorable body mass index or reducing the risk of gaining weight after you've lost it. Now, a 2010 study by Terry Dwyer from Melbourne, Australia, examined the relationship between changes in physical activity over a 5-year period and body mass index waist to hip ratio, and then also insulin sensitivity. And his participants were followed for about 5 years. At both time points, so pre-test and then also post-test, that 5 years later, at both time points, higher step count was associated with lower body mass index, lower waist to hip ratios, and higher levels of insulin sensitivity. And the author said if an inactive person increases their step count to 10,000 steps per day, one would expect a change in body mass of about 0.83 units. So body mass index is going to be kilograms per meter. So basically, it's your body weight divided by your height with a specific equation. They also found that improvement in step count was associated with lower body mass index, lower waist to hip ratio, and overall improved insulin sensitivity. The next study is by Dr. Seth Creasy from the University of Colorado, Denver. In this study, their results showed that individuals achieving a 10% weight loss at 18 months in their study were engaging in about 10,000 steps per day. These results suggest that the target physical activity expressed as steps per day is approximately 10,000. They also looked at stepping intensity. So with approximately 3,500 of these steps achieved, and an intensity consistent with moderate to vigorous bouts of at least 10 minutes. And they said, assuming that 1 mile of walking is equivalent to 2,000 steps, and assuming a walking pace of 20 minutes per mile, this would suggest the need for approximately 35 minutes per day of moderate to vigorous walking, plus an additional 6,500 steps per day of non-structured forms of physical activity, which you can achieve walking by going to the bathroom or walking to see somebody else at work. So it might not necessarily be at a higher intensity. So this lens supports achieving 10,000 steps, and hopefully some of those steps are coming from more planned exercise at higher intensities of stepping. The next one is by Carmen Cuthbertson from the University of North Carolina at Chapel Hill, and what she followed a little bit over 6,634 adults over 5.9 years. And what they found was a lower risk of diabetes with more steps per day, and adults had a 2% lower risk per 1,000 extra steps per day. So every 1,000 extra steps you take, you have 2% risk reduction of having diabetes 5.9 or about 6 years later. She found inverse associations between average step and diabetes incidence were observed across many cohort characteristics, but most importantly, among those adults who were at risk for diabetes. So these were going to be older adults or adults that had obesity or pre-diabetes. She found that adults who accumulated 17 minutes per day in brisk ambulation, brisk walking, compared to those who did 2 or under, had a 31% lower risk of having diabetes. She also says that a greater percentage of intense steps for a given accumulation of steps per day was associated with further risk reduction. She also said that the predicted risk of diabetes at 7,000 and 10,000 steps per day was 8% and 13% lower compared with those people who were achieving just 3,400 steps per day. She also states that there was an 18% lower risk of diabetes at 10,000 to 12,500 steps per day, and that's going to be compared to those individuals who are doing less than 5,000 steps per day, so sedentary individuals. She also found that adults without obesity, but adults with obesity who accumulated 10,000 steps per day, had about a 29% risk reduction compared to adults who only achieved 3,400 steps per day. But there was no association between adults who did not have obesity. So if an adult has obesity, having a high step count can be protective against having the risk of having diabetes. But if you're not overweight or obese, that relationship was not there. Similar findings were present for older adults. So among adults 15 older, those who accumulated 10,000 steps per day had a 31% risk reduction for having diabetes compared to those who just did 3,400 steps per day. But that relationship wasn't necessarily there for younger adults. And this makes sense. The longer time, the more exposure you have, the greater the likelihood that you will have a disease. She also found that adults with prediabetes had higher incidence rates of diabetes than adults without prediabetes. But the adults with prediabetes who accumulated 10,000 steps per day had a 26% lower risk of diabetes than adults with prediabetes who accumulated 3,400 steps per day. This relationship was not there for adults that were not pre-diabetic. So if you're pre-diabetic, if you are obese, or if you are older, that makes having a high step count particularly important for the prevention of having diabetes. And then the last study that I'll cover is by Sisson, who used the NHANES data set, which is the National Health and Nutrition Examination Survey. That's what NHANES stands for. They found that the prevalence of metabolic syndrome was 10% lower for every 1,000 extra steps per day. They found a 72% reduction risk of metabolic syndrome among those individuals achieving more than 10,000 steps per day compared to sedentary participants. So what are some conclusions here? So for diabetes, daily step counts as low as 5,000 can actually be beneficial if the person is currently sedentary. Increasing step count does have additional benefit, potentially even beyond 10,000 steps. And this is for several reasons. So more physically active individuals reduce the amount of adiposity that they have. Adiposity is a risk factor, so excess body fat is a risk factor for diabetes. Next, both acute and long-term physical activity increase glucose uptake in the skeletal muscles. This is because muscle contractions can basically bring glucose into the skeletal muscle without insulin. So this is because of a transporter called GLUT4, so glucose transporter 4. Basically, whenever your muscles contract, that is a way to bring sugar into the skeletal muscles without needing insulin. Now, for weight loss or the prevention of weight gain, evidence supports that people who walk more typically have lower BMIs, it's body mass index. Increasing step count can have beneficial effects, although it's unclear if there's a cap on this. Because weight loss fundamentally involves expending more calories than are taken in, higher doses of physical activity are probably beneficial. And there's certainly many significant health benefits associated with obtaining fewer than 10,000 steps. 6,000 to 8,000 steps seems to be where benefits start to occur, although potentially 5,000 for diabetes, but we want higher. An optimal dose of 6,000 to 8,000 steps seems like it's necessary to reduce the risk of all-cause mortality, but increasing step count is also beneficial. Dementia risk reduction peaks at about 10,000 steps. So if you don't want to end up having dementia, 10,000 steps is a good bet. And more steps also seem to be beneficial for metabolic issues such as diabetes and obesity. So the next question is, how can we increase our step count? I can think of step count as three different buckets. We could say incidental, habitual, and then also planned steps. So there's different ways to accumulate more steps throughout the day. I'm going to say incidental steps would refer to random acts of movement. I'm getting up to go to the bathroom, moving around at work. Habitual stepping, it might refer to what you do for commuting. Maybe you walk half a mile to go to work. So for example, I live in a city, so I do a lot of habitual stepping to get to places. Or I walk my dog, which also to some extent is habitual and also ingrained in my routine because I don't want him to poop in the apartment. Yeah. So planned stepping might be where you actually intend to and follow through on going on a longer walk or a longer bout specifically for exercise. So this is where we might be treating walking as exercise, where we're trying to go at a higher intensity. So for example, I might say after my dinners, I will walk for 30 minutes. So that would be planned exercise. It's not incidental. It's not me going to the bathroom and getting extra steps. It's not me walking to get a water at work, getting extra steps. So this is the only type of stepping that I think requires a certain level of motivation to complete versus the incidental and ingrained or more ingrained as our probably habitual stepping. It just happens for the most part because it's reliant on context. So habitual walking can also be increased by looking at your general routine and thinking about where walking can be replaced, maybe with other modes of transportation that you typically rely on. I think dog walking is great. So walking dogs have been shown to promote engagement and adherence to regular physical activity. So if you have a dog, it might be an easy excuse to build in longer bouts of habitual walking. It might also be easier to engage in planned walking, but building it into an already existing routine. So one behavior change technique is called implementation intentions. These are if-then plans. It's really helpful for routine building. For example, your implementation might look like this. After dinner, I will go for a 30-minute walk. So after a certain thing, you know that's going to happen. You plan on doing something else. Another way to increase your step count is through recruiting social support. So recruiting social support is another way to get your steps in. Maybe asking your friends or a partner to join you. Another thing I like to do is find hikes. Being in nature also has proven beneficial effects on mental health, as does exercise. So if you're able to take a walk in nature, you're really getting a double dose for your mental health. Next, how do we just make sure that we do it, or how do we track how many steps that we're doing? Because if if we know what we're currently doing, we might be able to set a goal to actually increase our step count. So if you have a phone, you likely already have a built-in pedometer. I said the Apple Watch, we've talked about the Apple Watch before. The Apple Watch is also great. It's a great resource as it keeps track of all of your steps. If you go to the health app on your phone, you can see how many steps you do daily, course of a week or month or 6 months, and also a year. So it has all those tabs for that. What I would recommend doing is trying to increase your step count by 10% or maybe 1,000 steps. So maybe if you're doing 6,000, try to push it to 7,000. Whatever you feel comfortable, really realistically, whatever you feel comfortable with. So now, 2,500 steps is roughly equivalent to 1 mile. So if you did decide to increase your step count by 1,000 steps in a month, that adds up to about an extra half mile per day. So that does seem like a relatively feasible goal. So just to recap, about the benefits of your step counts started about 6,000, 5,000 in some cases. If you're going lower, it's always good to increase your step count. 6,000 to 8,000 steps seems like the sweet spot for reducing risk of overall mortality, but it also seems like more is better for reducing the risk of gaining weight and of things like diabetes. So the metabolic issues, more steps are going to be better. It's going to be a good idea for you to look at self-monitoring. So how many steps are you currently doing, and then goal setting. Where would I like to go from there? Having more self-monitoring on top of that. So if I say I'm at 6,000 and I want to go to 7,000, I should be able to keep track of that and then really objectively be able to tell if I've achieved those goals.